Lutsey from the University of Minnesota, and I'm one of the chairs of this year's AHA Epi Lifestyle meeting. This morning, we had an opening session entitled Green World, Heart Healthy Living. Dr. Sanjay Rajagopalan from University Hospitals Case Western Reserve University gave a talk entitled Air Pollution and Climate Change, Convergent Solutions for Sustainable Cardiovascular Health. Dr. Rajagopalan, could you please share insights you have about the relationship between air pollution and cardiovascular health?
Thank you so much, Dr. Lutsey, and it's such a pleasure to be at this session and to be able to talk about this very important opening session. And again, thank you for the opportunity to be given the privilege of presenting. So my talk really explored the connections between air pollution and a growing existential crisis, climate change, provided data supporting the consequences of air pollution, especially towards cardiovascular events. Air pollution, many of the audience may not even recognize, or for that matter, many health professionals do not recognize an important association between air pollution and mortality, primarily through cardiovascular mechanisms. And the solutions for air pollution are convergent with those of climate change, which we all agree is a major problem facing humanity. The same anthropogenic emissions, fossil fuel emissions that contribute to air pollution also contribute to climate change. And therefore, the solutions that might address air pollution might also start to address problems related to climate change. So I also provide towards the end of my talk what society and individuals can do to protect themselves against the harmful effects of air pollution, and sort of touch upon some of the aspects that we could do as a society to avert not only air pollution related health consequences, but also air pollution emissions related climate change.
Would you mind also sharing what can individuals do to protect themselves from air pollution?
I think that's a great question, because we all know that fossil fuel emissions are not going away anytime soon. Our society is still very dependent on fossil fuel sources for really sustaining society. And it's going to be several decades before we see the end formally of the era of a society that was built, civilization built on fossil fuel. So in the interim, there is going to be the problem of air pollution, and there is going to be the challenge as to how individuals can protect themselves from the health consequences. And as I mentioned earlier, the primary modus operandi of fossil fuel emissions or air pollution mediated health consequences is cardiovascular. So what are the personal things that one can do? Well, the first thing is to identify individuals who are susceptible, or so-called individuals who are overtly sensitive to the effects of air pollution. And those include individuals that you and I know are high risk from a cardiovascular perspective. Individuals that exist in pre-existing cardiovascular conditions, pre-existing cardiopulmonary conditions, cardiometabolic conditions, type 2 diabetes, the elderly, the infirm, individuals who are immunosuppressed or with organ transplants. All these individuals are at high risk for effects attributable to air pollution. So in order to mitigate the consequences, one of the nice things, I guess the silver lining of an otherwise dark cloud of COVID-19, is that people are wearing N95 masks. And N95 masks are well known to reduce exposure to the most, injurious component of air pollution, which is a particulate matter less than 2.5 micron component. So the N95 masks are an excellent solution, not only for COVID-19, but to protect yourself against exposure to PM 2.5. Other mechanisms, means also may include usage of air conditioning, reducing exposure to ambient sources of air pollution, particularly important in segments of society or areas of the country exposed to wildfires, which we know is particularly prevalent in the West Coast and the mountain states. So that's something that you could do, is to ensure that you have air filtration systems, both indoor, they work quite well, as well as air conditioning systems. You know, if you happen to own an automobile, it might be good if you happen to be susceptible to avoid areas associated with high pollution. So, you know, being clued in to the alerts from your local, city regarding air pollution levels being hazardous might be a good way to pay attention and avoid crowded areas which are heavily polluted or high concentrations of emissions from trucks and automobiles. Might be a good idea. Taking alternate routes might be another. So there are a number of things that we could take to protect ourselves. But again, this is in concert with the warnings, from your local authorities regarding days that are particularly hazardous, to higher pollution levels.
Those are some very practical ideas to reduce risk.
Thank you very much, Pam, and I look forward to learning more in this very interesting conference.